Hey, Dr. McNamara here, and today I wanted to talk about some of the basics that go behind designing your own sort of exercise program to help you train movements so you move better, a little bit more mobile, but also gain strength and build muscle. So first things first is we're going to want to focus on fundamental movements, and this is to ensure that we don't have any imbalances in the body or that we're not performing any movements that may cause any certain injury. So the movements that I'm talking about is we'll start with the lower body, and those are going to be the squat, as well as a hip hinge, where we hinge at the hip, trying to avoid around the low back. And then for the upper body, it's as simple as pushing and pulling, both horizontal and vertical as well. So we'll go over some of those basics. So let's start with the lower body, the lower extremity. And in all these different movements, we also want to focus on our core and be able to brace our core. So we'll start with that. So first things first is to learn how to brace our cores. We make little L's with our fingers and we push in right at the belly button. From then, you're going to push out using your musculature of your stomach, kind of like when you were a little kid and you used to make a little pregnant belly when you joked around with your friends. But it should be kind of a nice hard and should be kind of protruding out a little bit. That's your transverse abdominis contracting, and that's going to help stabilize your spine for any of these movements. So first thing first is make sure you can perform that contraction. Then what you'll do is you'll find the bumpy parts on the front of your hip, put your hands just inside of those, see if you can make your fingers move down there, nice hard contraction. And then we'll also go down to the back where those dimples are. Those are the posterior superior iliac spines, PSIS for short. You're going to go just inside of those and do the same thing. You're just going to push out and make sure that your fingers can move so you feel a little bit of contraction. That indicates that we are stabilizing within our lumbar spine. Next, we're going to want to start to work on these fundamental movements. So the first one is simple. You can just do a squat. So there's many different ways that you can do a squat. A great place to start is just a simple body weight squat, trying to focus on getting the knees parallel and getting into a full squat position. If you find that difficult, one thing you can do is you can grab a chair and perform a squat that way from a seated position. This is particularly beneficial if you're having pain from sitting to standing, especially if you lack that strength. This is a great way to build it, is simply just practicing sitting to stand. And then over time, you can grab a little bit of resistance, such as a kettlebell, perform squats like that, or same thing, use the chair, perform it that way. And that's really going to help strengthen the lower body so that we avoid injury in the future. One more thing that I like to add when we're beginning a new exercise program for a patient is I like to start them off with unilateral exercises, meaning one side at a time. And this can help distinguish if there's any discrepancy between the right and the left side. So for example, if you're going to do a squat and you're starting in that seated position, a great way to practice one-legged movements is you'll just stand up using one leg. Really works well to increase strength and counteract any imbalances you may have. The next fundamental movement that we want to work on is our hip hinge. So similar to like a deadlift, things like that, where you're bending over. Think of picking objects off of the floor. That's where the functionality comes into this movement because we have to do that quite often in life. So what I like to do for patients with this is something as simple as, just a Romanian deadlift where you can grab a little bit of resistance or none and just working that hip hinge, trying to keep that flat back and working to get nice and low. A little bit of stretch at the bottom in the hamstring. Now to make that one unilateral, what I like to do is single leg RDLs. Same thing. We're just going to do it on one leg and you're going to hold the weight either in one arm to help with a little bit more core strength, or you can grab weights in both hands to make it even out. That's going to take a little bit strain off the core since we don't have to balance as much. But it's the same kind of idea, working that hip hinge and just working on your form and motor control. So that's the lower extremity. It's fairly simple. And again, I recommend doing unilateral work to help find any imbalance. For the upper body, it's really simple as well. It's as simple as taking some sort of pushing exercise. You can think push-up, bench press, or if we want to go unilateral, which is what I like to start with beginners, is just doing a one-armed unilateral press. And don't forget, we don't want to just do horizontal. We also want to do vertical as well. So grab some dumbbells, grab some kettlebells, grab some bands. Any sort of resistance is going to be great. If you don't have anything, even a gallon of milk is going to be a little resistance that can help us improve our strength. And the same is going to be true for pulling exercises, simple as some sort of horizontal pull and some sort of vertical pull. And then you can make that unilateral by just doing one side at a time. And again, use any type of equipment that you have, whether it's machines, dumbbells, bands, or just your body weight. Really anything is going to work great and it's going to get your body in better shape. As far as how many sets and how many repetitions you should do of each exercise, it's going to be dependent on the individual. If you're a beginner, what I recommend is starting very conservatively so you can work your way up over time as you get stronger and you improve your performance. So for beginners, what I recommend is anywhere from 1 to 2 sets just to start with, and then pick a weight that you can perform a good solid 10 reps with good form, full range of motion. Work to progress that up to about 1 to 2 reps of absolute failure, meaning that if you were to do 1 to 2 reps more, you would be completely done and no longer perform any more repetitions of that movement. And those reps may lie anywhere from 5 repetitions to 30 repetitions. It doesn't really matter. It's really what you enjoy, because those ranges has shown to have similar muscle hypertrophy and muscle strength gains regardless of training level. So really it's about the sets and reps that you like to do. We just have to make sure we're putting in a lot of effort so we're reaching that near type of failure. So I hope this information helps you guys when it comes to designing and creating your own exercise program. If you have any questions, please comment below. And if you like this information, please like and subscribe for more health and wellness. Thank you.